Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to 5 to Thrive Live, a podcast about thriving for those who have been affected by cancer and chronic disease. I'm Dr. Lisa Schuler. I co-host with my good friend and colleague, Carolyn Gazella. You can find all of our past show podcasts on every major podcast outlet, as well as ithriveplan.com. And tonight, I'm happy to be speaking with Dr. Joseph Vazquez. Dr. Vazquez is the current Associate Dean of Clinical Education at Sonoran University of Health Sciences. He's been practicing since 2013 with a focus in general medicine, physical medicine, and cardiology. Dr. Vazquez is active in naturopathic medical education leadership, representing Sonoran in organizations such as the Council of Chief Academic and Clinical Officers. And he is also the author of an important document called the Core Entrustable Professional Activities for the Graduating Naturopathic Medical Student. Dr. Vazquez is a member of the New England Journal of Medicine Insights Council, contributing to the topic of healthcare transformation with other executives, clinical leaders, and clinicians worldwide. And we're going to get to him in one moment. But before we do, let me also thank our sponsors. First, Cetria, a patented form of glutathione, clinically proven to raise blood glutathione levels. Glutathione is the body's master antioxidant and the primary defense against free radicals. And you can learn more at cetriaglutathione.com. We also thank ProThrivers Wellness Supplements, including ProThrivers Wellness Brain, a product specifically for thrivers that contains cognizin for memory, focus, and attention. And you can find ProThrivers Wellness Brain on pureformulas.com. And finally, Dr. Ohhira's Probiotics, a best-selling probiotic for over 30 years with 12 probiotic strains, shelf-stable without refrigeration due to a unique 3-year fermentation process. And you can learn more at drorhiraprobiotics.com. Well, hello, Joseph. Welcome to 5 to Thrive Live.
Thank you for having me, Lisa. I'm happy to be here.
Well, I'm happy to talk to you about this topic. We're going to be drilling down into a really important topic, and that is community health. And I think that there's no time like the present for this topic because healthcare needs are only accelerating. And this is, I think, such a really important part of the solution. So, let's kind of start with the big picture, and maybe you could help our listeners understand what community medicine is. And tell me, why do you feel it's essential to the future of healthcare?
Absolutely. A lot of people have heard the term community medicine. It's a very common term. It's been out there for quite some time, but I think you ask 5 different people, you get 6 different definitions of what it is. Community medicine, a lot of times people will understand it as medicine or healthcare that's accessible, that's available to those in need out there as a community resource. But truly, it's something a lot bigger than just that. In fact, the way that I've seen it and my personal experience with community health at Sonoran, it's essentially 3-tiered. You have that physical presence, the actual resource, but it expands beyond that. It's that cultural awareness, that healthcare model that meets different cultures, different individuals. And then finally, that social interaction, that social presence, because community medicine isn't just a static brick and mortar resource. It is a way of being. It is a way of meeting individuals where they're at and providing the things that they need, in this case, healthcare and health education. And so when you look at the term medicine, it's beyond just pathophysiology and biology and disease. It's really about access to healthcare, environmental impacts, education, all of those things that really have a huge impact on an individual's life. And so when you consider all of those things and how complex the term community medicine is in and of itself, you can truly appreciate it's a key factor and a key cog, if you will, in what the future of healthcare holds for us, not just nationally in this country, but internationally. When you look at traditional healthcare models, they struggle, they really do, in trying to treat chronic disease, health inequities, or just pure access gaps. And community medicine, at least the lens of community medicine, allows us to easily intervene earlier, build relationships with our patients, and create something that's sustainable, something that is proactive, prevention focused, and something that's really embedded into our patients' lives, into a person's life, as opposed to something that is just standing on the outside looking in. We're really trying to impact the individual as opposed to just handing out a resource for them to use on their own, because a lot of times our patients don't know what to do with certain resources. And so community medicine is a concept, more than it is just a brick and mortar resource.
Hmm. So, I mean, it sounds like it solves a lot of problems, which begs the question then, why is this not more common? There's obviously some challenges in taking healthcare out of the brick and mortar, as you said, typical conventional settings, and bringing that healthcare into the community. So, what are some of those challenges?
Sure. There are many, to be quite frank. So you tend to be working in environments that lack infrastructure. And in order for community medicine to work, you need consistency and access to resource. And so those barriers in and of themselves are quite difficult to circumvent. Another aspect with again trying to connect with the patient is that doctor-patient relationship, that rapport. Ultimately, what I'm talking about here is trust, is trying to garner the trust of the individuals that you're trying to serve. And you really garner trust by being empathetic and truly understanding where patients are coming from. Language barriers, transportation barriers, health literacy, all of those things you need to take into consideration in order to access your patients. But one of the largest barriers overall is just healthcare infrastructure. When you consider community medicine, the way that it's incorporated in healthcare currently, it's unfortunately an afterthought. It isn't something that is not necessarily embedded into undergraduate medical education, into residencies and fellowships on the grand scheme. It's something that is considered after training has happened, after a medical student has done X amount of abdominal exams and X amount of neurological screenings. And so, at least at Sonoran University, I'm fortunate enough to be in a position where I can really impact our clinical education program for students to have access and awareness of the patients that we will serve as they're training. And so when you enter community spaces, you're trying to remove those barriers that exist. The physical barriers, yes, but those barriers that you can't see and you don't really see until you truly appreciate and understand a patient's lived experience. And that's fundamentally how you should be practicing medicine anyway. And so when you consider the future of healthcare, community medicine, again, at least the concept or conceptually, the concept of community medicine is really where the future of both medical education and healthcare should be heading.
Hmm. Speaking of medical education, and I love by the way, the very personal focused, individual focused perspective that you have around community health. It really is about the individual person. So it's very person centric, which I think is a part of its healing magic. But going back to medical education, you've done important work in shaping medical education for hundreds of naturopathic medical graduates. And how is naturopathic and integrative medicine training evolving to kind of meet these changing health needs, especially in this framework of community health?
Yeah, to expand a little bit on the concepts, I was kind of finding myself going down a rabbit hole. Sorry
Mhm.
about that. But medical education as a whole is evolving greatly, not only because of demand, but just our access to evolving technologies, AI, a lot of things that are going to put us in a better position if we know how to utilize those resources, and if we, safe to say, keep our eye on the prize, which is, what is it that we're trying to achieve? And we are trying to impact an individual's life and an individual's healthcare status. So when you are looking at what is the goal of medical education, and that's really converting the ambitions of a highly motivated student from being purely knowledge based to being someone who is experientially driven, someone who can do it. Not only do you know it, but can you do it? And when I say that, it actually means a lot of things, not just going through the motions, but can you piece together not just the algorithm of disease, but can you piece together understanding and how this is going to apply to a specific patient, to the patient who is in front of you at a given moment? And I think that's truly the art of compliance, the art of medicine, if you will, is understanding that you are working with an individual who is nuanced, who is unique, who has their own barriers that doesn't necessarily fit the mold of population health medicine. This person is going through a unique experience, and the physician needs to know where to meet that patient and how to incorporate what is best for them in regard to healthcare. And so when we are looking at medical education, that's exactly the direction we're going. As you had mentioned earlier, I was fortunate enough and really had the great opportunity to be a lead author for the entrustable professional activities of the graduating naturopathic medical student. And those entrustable activities are essentially us determining what is the expectation of a student who has graduated and is now a physician. What do we expect a physician to be doing? And no longer is it truly just statically competency based. And don't get me wrong, competencies are important, but we are translating those competencies into actions, into behaviors, into a model that we are looking for, that we know is going to be impactful for an individual. And as such, when we're graduating generations of students in this manner, we are impacting healthcare as a whole.
Yeah. Yeah. Beautiful. Well said. So you mentioned AI and some other really interesting new developments. Another thing I know that you're very passionate about is group medical visits. And I think you and I both agree that these group visits have a really important potential role to play in community health. So can you tell us a little bit more about group visits and how they fit in?
Absolutely. I mean, I think group medical visits is such a simple concept that is just underutilized and untapped presently. I was fortunate enough to complete a fellowship with the Integrated Center for Group Medical Visits just last fall. And I got to see firsthand how the impact of a group setting, how it really, really is still individualized healthcare. I think one of the big detractors, or one of the big concerns with the concept of group medical visits is that I will no longer get individualized healthcare. And rather, when you look at group medical visits, you're adding the number of patients, yes, but you're actually adding the number of providers at the same time. And that's something that most individuals don't necessarily appreciate. Not only do you have the provider who's leading the visit, but now you have a support team, a network. You have content experts that are there to assist you, and they just happen to be fellow patients. And that's really where it goes back to that concept of compliance, but also being with individuals who essentially know exactly what it is that you're going through. And when you have questions that maybe your physician may not be able to answer because they themselves haven't been through that experience, you're now next to resources that have been, and they can tell you, you know what? Yes, it's actually very hard to quit smoking in those first couple of weeks. But for me, about a week and a half, things got a little bit easier. And then someone else adds, you know, you're right. About a week and a half, 2 weeks, things were easier. And then I also did this to kind of keep me distracted. And it builds on itself. And lo and behold, your hour visit is feels like it's been 5 minutes. And you have patients coming back for more because they want access to those resources. Those resources happen to be your fellow man, the person sitting right next to you. And I think that's such a beautiful thing. And it actually, data wise, translates to amazing health outcomes. Not only health outcomes, but significant healthcare savings, not only for the individual, but on the grand scheme from a national perspective. The amount of millions of dollars that are saved in Medicare alone just from group medical visits is astounding. We're talking millions of dollars just for a single practice. So again, it's a fascinating concept that I think is just underutilized right now.
Yeah. And you kind of touched on this a little bit in your example of the smoking, but what that says to me is, or it touches on this idea that isolation in our communities is such an important aspect of ill health, and addressing isolation is really an important part of healing. I know there's a lot of articles just on the deleterious impact of isolation, and it seems like group visits, in addition to the substance of the visit, foster connection and empowerment among patients because they're in community. And I would imagine this is particularly the case in underserved communities who are already struggling in many ways. So I'm just wondering if you have any comments or thoughts along those lines.
Absolutely. The founder of the Integrated Center for Group Medical Visits, Dr. Jeffrey Geller, the concept for his organization actually was born of his research, which was he thought that the number of emergency room visits was actually directly correlated with the concept of loneliness. And so the more lonely that an individual was, so essentially the lack of support network and so forth,
Mhm.
actually led to increased ER visits. And so when he incorporated group medical visits, he did find that correlation that as you address loneliness, you actually improve healthcare outcomes. In this case, his metric was the number of ER visits. And I think that is absolutely true in regard to the populations we serve with community medicine. A lot of times patients have just very, very complex illnesses, ailments, and so forth, which need weekly attention, sometimes even daily attention. And other times, individuals just want an opportunity to connect. And this is where I see great opportunities for community health to expand at Sonoran, not only from just the wonderful healthcare services that we provide, but providing opportunities for community engagement so that individuals have access not only to resources, but to each other. Because we know not only just from the evidence, but seeing firsthand on a daily basis with our patient care, that patients improve when they can engage and have autonomy over their health. And it's not necessarily an individual process. It's very much an engaged group process. And again, it's just really wonderful to see that come together.
Mm-hmm. Absolutely. So I guess I want to switch gears just a bit and talk a little bit about what is required. Like, you are involved, obviously, in training future healthcare providers. So from your experience, what is needed for these providers to be successful in bringing community-based and, really frankly, integrative models of healthcare forward?
Yeah, that's a really good question. And it comes back down to the individual. So there are many ways that I can create an infrastructure within our medical education model to expose our students to community care, to have them utilize technological resources to ensure that their foundational knowledge base is more than adequate. But it really comes down to the person and reminding themselves, why did they engage in medicine in the first place? And so healthcare is moving in that direction. We want to prevent disease. We want to address population health. And that last component is where it really falls down on the individual, and that's just personalization. How far are you willing to go to connect with an individual and remind yourself that the reason I joined medicine was so that I could impact someone's life and that they could have a better quality of life. And so that part is extremely important. And I know our medical students, they join for a multitude of reasons. And I think any of us that have gone through a rigorous academic program, halfway through, sometimes we forget why we were there in the first place. Many of us find ourselves asking, why did I decide to do this to myself? Um,
Hmm.
but quite honestly is, from a infrastructure administrative perspective, it is my job to provide opportunities for students to remember what drove them to be so passionate about medicine and so passionate about serving others. And I think that's truly where we see the most successful physicians out in practice are those that are still impassioned and empowered from that emotion to continue to improve, to continue to make these significant impacts on individuals' health and ultimately the community as a whole, because it is that model of practice, that model of perspective care, that is really the core of what medicine is all about. And I feel like sometimes that is lost, and we need to do a better job of creating stopgaps, if you will, for students to just take a step back, remember why they're doing this. And so when they graduate, that's the last thing on their mind is they've come full circle. They have the tools and the training. Now they can set forth in the world and actually make a difference.
Yeah, I love it. Um, yeah, love the passion and that answer too. That was great. So, where do you think medicine is heading? And is community medicine a part of it?
Absolutely. When you look at the future of medicine, especially in this country, um, we're a little bit all over the place. There's an older documentary came back out in 2001, which I don't mean to date myself because 2001 doesn't sound that old, but the the lead was actually looking at healthcare models across the world. Um, and at the time, Taiwan was actually looking at building their healthcare structure. And they created a blue ribbon panel and traveled around the world to essentially survey how other healthcare models were working. And the leader of that blue ribbon panel was asked if they had traveled to the United States. And he said, yes, yes, in fact, we did. And then he was asked, what did you think of our model? And he said, well, you don't have a model, you have a market. And so you have a capitalistic market. And if you just let healthcare happen without a structure, you get the US healthcare system.
Mhm.
Which is really interesting because that's exactly what we have. We have well intentioned individuals, we have well intentioned initiatives, but when you look at the infrastructure of our system, it is still, at the end of the day, a market. And so I think the largest step forward that I have seen, especially with my work on the New England Journal of Medicine Insights Council, is the adoption and utilization of value-based healthcare.
Mhm.
So essentially, tracking an individual's health and preventing them from having to use high-level interventions later in life, which I think is a remarkable way to look at health. I think that's truly the way to go. The problem is when you try to implement a model like that in a reimbursement system that doesn't necessarily reward that model, it is hard to sustain it, extremely difficult.
Mhm.
In fact, one of the best countries in the world at value-based medicine is England, Great Britain. Great Britain, even though there are horror stories about the NHS and wait times, which they're improving, and
Mhm.
quite honestly, there are pros and cons to any healthcare model. But over there, they're actually one of the world's leader in preventative health education collateral for patients, because their general practitioners or their gateway doctors are actually incentivized to keep their patients healthy. Go figure.
Mhm.
They actually receive a bonus from the government at the end of the year for the number of patients who don't need a high level referral. Um, And so again, the government initiative is that, hey, let's actually invest in preventative health. Let's invest in collateral and education for the public so that they stay healthy, so that it doesn't cost the taxpayers more. And we have fewer individuals who are using those more expensive, higher level interventions. And that is a concept, value-based healthcare, that we in the United States are looking at currently as well. But again, there are a lot of obstacles that exist for us to implement such a model on a national level, because of the reimbursement model, because of the delayed gratification, if you will, in regards to the cost savings, to the individual, to insurance, and to the government system as a whole.
Yeah, so let's just take this all the way down to the individual. So we have individuals listening to this podcast, some of whom are practitioners, some of whom are patients. Let's assume for a moment that they all are listening and thinking, I like this concept. I want to support this. How can people, just whether they're a practitioner or patient, help clear the way for more community health and more, as you said, kind of preventive oriented medicine?
Sure. Engagement, I think, is the lowest hanging fruit. Find ways where you can contribute to this model, this vision, as best as possible. If you have opportunities, where you live, engage, volunteer time, be involved. I have seen firsthand impacts on a patient life, not only from the physician, not only from the medical students that are aiding with that patient's care, but on the level of volunteers who are handing over resources, handing over food from a food pantry, having a conversation with the patient and letting them know about resources that they maybe forgot to mention to their physician. Again, that is what community is. That is the heart of it. And that is something that we are standardizing and moving forward with at Sonoran University. Sonoran University has a nonprofit arm, the Sage Foundation for Health, which is our funding arm, that all of the monies, the donations, that Sage collects go directly to our community clinics. And our community clinics offer absolutely free healthcare to all the patient populations that we serve. So the patient pays nothing. They pay nothing for the services. They pay nothing for the recommended supplements, medications, imaging, what be you. They don't pay a dime. And so, in fact, we sometimes have difficulty, especially when we open new clinics, difficulty recruiting patients because they think it's too good to be true. They think there's a catch there. And once they realize there is no catch, you find that we're actually booked out for months. And so another way is to find organizations that you know are very committed to this cause. Sonoran University and the Sage Foundation for Health being one of those committed organizations. And in my role, I oversee our community medicine arm, and I will say, not only has it been the majority of my work since I joined Sonoran University, but it is probably the thing that I am most impassioned about, and something that I have seen the direct impact of my work translate to the impact on the individual's life. And I'm very grateful for that experience, and I'm very grateful to continue working in that role.
Well, I would be remiss if I didn't acknowledge that I'm the president of Sonoran, and I personally and we at Sonoran are very grateful to have you, Dr. Vazquez, because your passion is evident and your skill and tenacity with expanding the community health network and doing everything you can to raise donation dollars to the Sage Foundation for Health. All of it is so deeply appreciated. So thank you for all that you do. And we're just pretty much at the end of the show. Do you have a 30-second last thought you'd like to leave with our listeners?
Yeah. Remember that medicine isn't just a doctor and a patient. Remember that medicine is actually an even playing field. You have two individuals that have different resources, different knowledge bases, and they're coming together to have a conversation. And as much as a physician is impacting and improving the life of a patient, that interaction goes the other way. And that patients hold so much power. And I know from my personal experience, they impact me on a personal level. And the interaction is extremely mutual. And like I said, it's a work of beauty. And I think we forget that sometimes that healthcare, medicine, it really goes both ways. It's healing both ways. And I think community medicine really captures that concept, but it's not limited to just community medicine. That is what the art of medicine has and continues to be.
Love it. Well said. Well, thank you so much for joining me. This has been a great show, and I really appreciate you taking the time. Any websites or social media you can share?
I have joke. I don't have social media unless you consider LinkedIn social media. I have that. And I drive our marketing team crazy because of that. But I am I have to be honest and say I have two passions in my life. The first, my priority passion are my two young boys who are 10 and 11. And the second is my work at Sonoran University. And I'm not just saying that. It truly is my life. Again, my family and my work at Sonoran. That's basically what I do. And I thrive off of it. I am very happy doing it. And so if you want to learn more about me, if you want to learn more about the work that we're doing with community medicine, please go to sonoran.edu and you'll find more information about what we're doing there and my contact information there as well.
Okay, great. And then also it's sage.sonoran.edu for the charitable tax organization that supports this work that you're doing. Well, that wraps up this episode of 5 to Thrive Live. Again, I thank our sponsors, ProThrivers Wellness Brain Formula, Cetria Glutathione, and Dr. Ohhira's award-winning shelf-stable probiotic. And you can, as a reminder, find all of our past shows on ithriveplan.com or wherever you listen to your favorite podcasts. Thank you for joining us. May you all and each experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.